So, starting at the end, Sara is the founder of Luminary Labs, and she has catalyzed funding and progress across many different sectors, from health to climate, with public-private partnerships. And she'll talk a little bit about what she's doing with the Bezos Fund. Jenessa is not only an athlete, but the founder of Ecologicca, which is a climate health company focused on the health benefits of indoor air quality, where you integrate hardware and software. And Joel, not to be the last, is focused on electrification, but he comes from a background of running all of the real estate for Google, and you can correct me if I'm representing that incorrectly, to make sure they're carbon neutral. And I am Joyce Tong Oelrich, and I'm a partner here at Fenwick and work with companies to find federal funding, which is non-dilutive, and there is a lot of it. So the first question that I'm going to have is for Sara, which is, there is an intersection between climate and health, and it intersects between individuals to systems to a very holistic, circular system. From your perspective, how do you integrate those two, and where would you invest your time and energy?
Well, reflecting on this morning's conversation, I love the point about climate has an effect on health and health has an effect on climate, and nothing is really in a silo. We need to look at all problems that matter through a few lenses: equity, climate, health, etc. And I think about it like this, and when I started Luminary Labs, we were very much in the health space, and quickly realized that a lot of the blame is put on the patient. You're not compliant. That is an actual term, right? Non-compliant is horrible. You're not taking care of yourself. If you don't do this, you are going to have to go on insulin. And when you think about the world we live in, we can't extricate ourselves from the buildings, the city, the societal structures that either help or hinder your ability to eat well, exercise, breathe clean air. So that's sort of how I think about it, going from the system to the human. And humans do have individual responsibility, but I think we skew far too much towards, like, you need to do something. We need to do something. Not where would I invest? Is that the question? I'm an angel investor, so where would I invest? I love what is it called? Mental cross training. I love it when two different spaces come together. Some of the most brilliant ideas come from analogous spaces. Something that we do a lot in our work when we're looking for new innovators on behalf of the federal government and other entities. We say, okay, if I'm looking to detect biothreats in the subway, which is something we did work on, who knows how to detect something really well? Because, like, a biothreat, or a chem threat, everyone's dead before you know. You can't actually do a lot there, but a biothreat, which this is a year before the pandemic, how would you know? And we ran through companies that do that well, and it occurred to us that credit card companies know that $1.50 at a gas station is going to be followed by $5,000 at Best Buy, and you get that phone call. And so I like to invest in people who, yes, have the subject matter expertise, but are open to looking to other industries.
Cool, thanks. Jenessa, the second question is for you. And I would like you to give a little bit of how you got here and why this company came to be. But we've been talking about the air quality impact on health. How has technology helped, and how has it tried, how would it try to reverse the climate impact?
Yeah, absolutely. So to provide a little bit of color to, why I'm so passionate about the intersection between climate health and tech and human health I started my company really based on my own personal experience. So when I was 12 years old, I became a chronically sick kid that could not get a diagnosis. And we went through years and years of trial and error trying to figure out what was wrong with me. My mom's a mental health professional, so we look at health very holistically. And my dad has an autoimmune disease, so we also are very tuned into how inflammation affects all different areas of your body and where inflammation can really be triggered. So I was a professional athlete for a number of years, a runner, and even at that time I was getting extremely sick. And after years and years of this, we essentially realized that I am like a canary for air quality, which at the time was extremely random. And whenever I would tell people about air quality and the impacts on health, people are like, that's not a thing. And I'm like, yes, it is. So that's really why I became very passionate about, the environmental determinants of health and really bringing that to the forefront of the way that people think about health. And when we think about health and climate, like you're saying, people do think about it in these silos, but the truth is, the Earth is a closed ecosystem. So everything is highly, highly interconnected. And one of the things I love about the way that technology is bringing these two intersections together is it is quantifying these impacts for people and bridging that gap where someone who maybe doesn't have a personal understanding of the issue or can't really see it, it allows them to at least see data, at least see facts, those kinds of things that can then help to convince them. I think the average touch point that a person needs to be converted is like 17 touches at this point. So technology allows people to start having those 17 touches so that we can be more informed about our health, do things about it, but also make better climate choices as well.
Great. That's interesting because thinking about excuse me, thinking about climate and health, obviously infrastructure has a lot to do with it. There's a lot of climate impact that comes from building buildings, putting in heating and air systems that connects the air and the quality of life for a lot of individuals. Joel, how does this intersection between health, climate, and infrastructure come about, and how would you, given your background and how you've seen companies deal with it, as well as individuals, and how do you bring those together?
Well, I think I'll maybe tell a story like Jenessa about the genesis of the company I'm at now, BlocPower. So I joined 4 months ago from Google, and I had a very cool job at Google leading global net zero strategy for 800 buildings around the world, and the company obviously flush with cash and super ambitious to innovate at a scale that no one else can. But I was attracted to BlocPower because of some of the comments here today about this mission needs to be applied in an equitable way to the most marginalized communities first. And our founder at BlocPower is a young, very dynamic guy named Daniel Baird, based in New York City. He grew up first generation immigrant parents in affordable housing, and he tells his story about how when he was a kid, the heating system in his building would fail, and they would open a stove to heat the building in a way just to help them maintain certain basic levels of comfort. So disastrous for human health and climate reasons. And our founder built a company to address that very real challenge. And so our business, BlocPower's business, is to electrify buildings. There was discussions today, heat pumps, local law 97, we need to get gas, fossil fuel infrastructure out of buildings. One of the things we used to say at Google when I was running the strategy globally to try to simplify it was, we will never be carbon free if we heat our spaces, water, and food with gas. And BlocPower is a company that is designed to help address the fragmented industry you described about its friction. To combine finance and incentive management and construction management and design and the post-renovation measurement and verification, all of that typically is across many different companies and makes it really impossible to do. And we've developed a streamlined turnkey set of solutions to help reduce that friction. But it is still very hard to do. Going to a private building owner, even when they're going to be regulated by Local 97, even when there's all kinds of incentives available from the federal, the utility, the cities, having a building owner who's got lots of different competing challenges, retrofit a building before the gas furnace dies is a really challenging thing to do. And so it's a long answer to say, if the health outcome can be applied to the suite of reasons as to try to nudge that person or nudge that city or nudge that utility in a way to make these projects happen, then that's what we need to do. Because there's a ton of research building upon how, especially the gas stove, if you can remove that and all the amazing health outcomes that'll come with it. And there's even some, BlocPower's published white papers with MIT and the Green and Healthy Homes Initiative to try to advocate, is there ways we can bring more funding to building electrification projects from the healthcare industry as a way to, as Sara described, right? Where does the magic happen when these industries start to coalesce? So it's exciting for us to try to think about new ways we can try to enhance our offering or the value proposition, but man, it's also very scary because there's a lot of work that needs to be done.
And that's a great segue because, my next question for all of you was really, whose problem is this? Is it the government's problem? Like we talked about how health systems always say that it's the individual who's not doing it. And then, if we pass regulations, then you're holding the businesses accountable. But how do we do this if there isn't a tone from the top using corporate speak or any mandate that brings everyone together?
I can talk about that a little bit. So, in the space of air quality, thankfully, this is becoming something that is starting to be regulated. So I think that people have gotten to the point where, there is a bit of this bottom-up, top-down that needs to happen where pressure from the individual and education from the individual needs to then inform the decision makers. I know that within the United States, there's a federal regulatory body called ASHRAE that monitors and mandates all the built environment. And they recently passed a regulation that is requiring that every single building in the entire United States has to improve and track their indoor air quality to reduce airborne aerosols. Essentially, they're trying to reduce the risk for the next pandemic. The issue with some of these regulations, however, is that this regulation requires for significant increased ventilation, which increases a ton of energy consumption. So it's in direct competition to all the decarbonization efforts that we're putting into place. So when it comes to, who has the burden of bringing change about, yes, the government can put in systems that will encourage people to adopt these better methods of improving health and improving climate, but I really think it comes down to the innovators. To find these solutions and find ways to allow buildings and allow people to improve health, improve climate, do all of those types of things. And then it really is about adoption and being having those people that are willing to take the risk, try these things, knowing that in the future, maybe they don't see it right now. I think that people are very focused on climate right now, but they're so highly interconnected that we need to start building in the systems today for the future of health. So I think it really then comes down to these businesses that are like, yeah, I'm going to adopt this. Yes, I'm going to go and I'm going to put my hand up and do something for both climate and health. So there's kind of responsibility on everyone. And I think that that's the beauty of technology is making that available.
I have a really sarcastic answer, but then I think that's not appropriate.
I think you should still say it.
Well, pragmatically, I do think it's an all of society burden. And the reason is the best innovations have to withstand the turbulence of change, leadership change, whether it is your president, your mayor, your CEO, your funder. And having worked in a number of different industries and being there, I started my career actually down the street in 1999, early internet, in the right place at the right time. That was a very good time. And then HealthTech early on, and now seeing ClimateTech in other spaces. You go through these curves where there's all that excitement, right around about the hype curve and all of that. But to get the adoption, ultimately in a capitalist society, and we do live in a capitalist society, we need to make it work for the money to flow. There are many innovations in health tech that exist The change isn't because we don't have the technology, and I would say the same is true for a lot of climate tech. Like, this stuff exists, how do we put it in the hands of people? So I think about it as like, you've got carrots and sticks. The stick is usually policy, like I'm gonna tell you, you have to do it, and sometimes you do have to do that. And then there are carrots, and carrots can come in different ways, and funding is, for the startup is funding, like we were the researcher, and we'll talk about that in a bit. But also for the large corporations, they need to see, how am I gonna continue to make as much, if not more money doing this? Because if I make that bet right now and my stock takes a hit, guess what? I'm out. There is no board on this planet, maybe there's one, I don't know, two, that is going to allow their CEO to make a wild bet for the betterment of the planet. That is not the function of a corporation. And that's that's my sarcastic, it's not sarcastic, it's real. So that's where I think that tools from government, from philanthropy, and from the private sector, both large organizations, the incumbents, are so important. The innovators, yes, you're gonna come with ideas, you're gonna find new ways of working, but somebody has to fund it, and somebody has to help you get to scale. So I think all of these working in concert at different times based on like how well government's functioning, or how well corporate America is functioning, because it does ebb and flow over time.
I'll probably just be agreeing with everyone here. I mean, I think Ben said it well earlier about we're not going to win based on a climate environmental argument. You're going to win on a better product, like kind of Tesla has shown. People buy Teslas because they're cool, not if they don't care about the environment. I had a fairly viral LinkedIn post in my nerdy green building world where I said software does not decarbonize buildings, and then I kind of said below, people do, companies do. Incentive management, finance, and it got viral, got a lot of people's attention because a lot of people are in the climate space working in software saying, I have a roadmap or a framework or some kind of analysis tool, but like, it still takes people going into a building. This is my lane, buildings, but you have to have physical people walking into a physical space, turning wrenches, pulling boilers out. Like, software can't do that. I almost want to follow up with another just cheeky viral post, maybe to say like, government also doesn't decarbonize buildings. Inflation Reduction Act is great. Our company is super in the know about how to deploy it, where to deploy it, and how to take advantage of it. It's still very difficult to sell projects. There's never been a better time to leverage private capital plus the public incentives and rebates that are flowing down now to cities to get this work done. But we still need better heat pumps. We need better tools to manage those heat pumps, to manage the growing increase of ventilation at the same time of decarbonizing our systems. So, it's a call to action to the climate tech community. Maybe stop thinking so much about software and think about products that can help us actually decarbonize physical spaces.
And that's a great answer, because then that's a great segue into the next question, which is the HealthTech piece to this, right? Because it's both, we're talking about climate and how to improve climate with technology, but there's this intersection with health tech, and we had a question earlier about, AI and data-driven extreme uses of energy to do these types of developments. From the health side, how do you intersect, as Sara put cogently before, how do you come to that intersection where you cross-pollinate between health to climate, climate to health, and maybe get the two separate stakeholders to work together?
Yeah, it sounds like a question for me, because that's what my company does. So for us, really, it just starts with education, right? And finding the way to get education to mass scale. So it's data collection, but also being sure that you're speaking the same language of the people that you're talking to. So if something is really important to a specific topic, like absenteeism, or test scores is really important to schools, it's super important to be able to say, hey, here are the environmental factors that are going to affect test scores, and this is how we can help children improve in these areas. So when it comes to marrying these two things, we take an approach of, let's take a top-down, bottom-up, let's go macro data for environment, macro data for health. Let's look at whatever we can that's been very well tested, is foundational information that can't be disputed, and then use microdata, biometric tracking, indoor air quality sensors, all of these sorts of things to validate and invalidate those assumptions that we have from the research in order to ensure that the information that we're giving people is accurate for them. So, at this intersection of health and climate, people are starting to understand it and they are open to it, but it really is, it's about speaking their language and then also ensuring that you're enabling them to do something. And this goes to Joel's point where it's like, yeah, software is great and it's more than 50% of our business is this data correlation and analytics side, but it's also you have to do something. So when you tell someone, hey, a great example is that there was a paper that was released by The Economist where it talked about 1 day of worsened air quality a month resulting in essentially a 1% increase in depression diagnoses, loss of enjoyment in life, and actual suicide rate increases. So if we're all now experiencing that with wildfires and I'm like, hey, here's the information, good luck, it's not that helpful. So having solutions that actually enable people to do something about it is also really important. And I think that when we talk about, like Joel was mentioning, like there are physical components in technology that need to be brought forward. Yeah, data is great and software is great, but we have to have these components, and otherwise there's really not much we can do about it. And sometimes information can be empowering and sometimes it can be crippling.
Check the time, 5 more minutes, and then we'll open up for questions.
Well, I'll just add to that a very anecdotal story, but I grew up in Allentown, Pennsylvania, and but I spent most of my professional career out west, city of Santa Monica in Southern California, Google, very different places than where I grew up. So I have some family members that sort of lean conservative in Pennsylvania and often make fun of me for my hippie, green building, sustainability career. But there was a recent study about gas stoves contributing to increased asthma in young people, and I had a few of my aunts who, I'm telling you, they're posting on Facebook about Trump all the time, and they're not going to be the first ones to advocate for clean energy. They reached out with a very serious question. Is this true? Do you know about this? What should we be doing about it? So I'm like, as you can probably tell, learning more about the health side of the work I've done. I've been very environmentally driven for most of my career, but now at BlocPower, the company already has been leaning into this idea. Our program in the city of Denver actually is called a Healthy Homes program. We're electrifying buildings, but the city's calling it a Healthy Homes initiative. And there's a professor at the University of Colorado who's involved with the data collection post-retrofit to try to contribute to the data set. So I have this anecdotal story about my family, and this new company I'm at is leaning into it, and I'm meeting very cool people here who already know more about this. I think it's a great opportunity to really combine these important forces of, we have a changing climate and we have a health crisis, and some of the things we all do for work can address both.
Great. So the final question for you is to leave us with some thoughts about what you would like to see next, what you are planning to do next, and talking about the hope and the optimism in going forward.
Can I talk about money?
Yes.
Okay. So I mentioned a little bit earlier, it's all about how the money flows, and there are many colors of money, as they like to say in government. Most of you are familiar with venture capital or angel money, right? That's dilutive. That's great, that's wonderful. The federal government and philanthropies offer a lot of non-dilutive funding that can come in the format of, sometimes it is a federal grant, but also prize money. So at my firm, we have a couple programs and things in the wings. So we'll be launching the Bezos Earth Fund $100 million AI for Climate and Nature Loss Prize very shortly. That's a lot of money. We're expecting a lot of submissions, but if that's you, think about that. It'll be coming out soon. But also, Kidney X is a public-private partnership, and we've worked on the Artificial Kidney Prize, new ways of reinventing dialysis. This is a space where not only do dialysis centers need to be more resilient, but they also need to consume a lot less water and energy. And so that's something that's very much on their minds. And so there, stay tuned, there could be some more things coming out from KidneyX. Diagnostics, Slimex, there are more ticks because of climate change. So that is inherently a health problem, but made worsened by climate. Vaccine patches. Vaccines are not thermostable. You have to refrigerate them. People do not get access to vaccines in many parts of the world. So we're running a $50 million vaccine patch prize for BARDA. That's the entity that worked on Operation Warp Speed. So my optimism comes to you, and keep your eyes open. I'm glad I sent a list of links, places you can keep. They're looking for people like you. They want innovators and academics and large companies and teams coming together.
I feel like I'm always just very optimistic about this. I get really, really excited about the future of technology. So it's super exciting being in a group in a room like this where everybody is equally as nerdy about it. But I think that one of the things that's really fantastic about the way that technology is changing currently is that I think that people are much less guarded and much more willing to be collaborative. I think especially on topics like climate health and human health, if you really understand the issue, you're not trying to safeguard your technology or your clients as much as you're hey, we need to contribute to something that's actually going to be impactful. And if that means that we work together or we work together and maybe we, of a contract, we each get a slightly smaller piece, but the pie is infinite. I think that people are really changing their mindsets about that, and it's actually resulting in real change that can start happening. And even when we talk about data collection and AI and the energy use that's associated with it, I think that this collaborative mindset helps to mitigate some of those issues, because I don't need to collect the exact same data that Joel's collecting. We can just work together on it. So I get really excited about the tech community and how that mindset has changed, and it makes me extremely optimistic about the speed that we can do things in, the work that we can complete together, but also the way that we can do it in a responsible fashion.
It's really well said. I'll just add, for years in the green building world, the North Star was a net zero building, a building that produces as much energy as it uses over the course of a year. And I was at a recent green building conference, and there was a panel talking about grid interactive buildings, and the statement was net zero buildings are good, but grid interactive buildings are better. And Sara mentioned resiliency. I think probably we didn't talk about that enough today. But when you ask what's next, I'm constantly looking at, my title at BlocPower is Head of Green Cities. We have a number of ways we work with real estate, but we try to sometimes engage directly with the city to help them be an implementation partner. And when you think about cities and their collection of buildings, there is so much heat loss in one building while the building next door needs that heat. In very simple ways, as we get better at interconnecting devices to the cloud and having buildings be smarter, these are buzzwords you hear a lot, and there's lots of cool companies working on this stuff, but we're starting to get better at deploying them. And companies like us, which again, we go into a low and moderate income multifamily building and we try to install heat pumps and replace gas infrastructure. We can throw incentives at it, we can throw our financing at it, but sometimes it's the owner says, well, that doesn't pencil. So if we can say, well, if we can install some devices that allow this building to be grid interactive, so when utility is really overburdened and maybe just asks you to turn your set point up a degree, and we'll pay you for that modification to your system, then that starts to change the calculus, because a gas boiler can't be that smart, an electric heat pump can. So I would say all of us can't be in this field if you're not an optimist. So I'm optimistic about it, but we gotta move fast, that's for sure.
And we'll open it up for questions.
Hi, thank you so much for this panel. I think it's incredibly important to solve for this intersection between health tech and climate tech. And I hear about a lot of solutions that are looking to support marginalized communities, but what I haven't heard so much from is how do you engage these communities? Because I think it's really important for people working in this space to engage directly. So I'm wondering if the panelists can share how their companies engage directly with the communities.
100. and like 20%? Yes, excellent question. When we look at a problem space, we start with an understanding of why that problem has not been solved. Sometimes it's the science, like foundational science isn't even there, but more often than not, you need to talk to, you just really need to talk to real people on the ground. You need to understand what are their behaviors, what are their motivations, what are their blockers. We oftentimes will bring together communities in like a roundtable fashion, like a meeting of the minds. When we say we're having an expert meeting, they're not all academics. They shouldn't be all academics. They should include a breadth of voices so that we can pressure test our assumptions. The worst thing you can do is have like all of us with like calculators sitting in a room making a decision. So bring in real people who are on the ground, bring in caregivers. So we found like, for example, patients, caregivers, healthcare providers, investors, and startups. Say you have 20 people in a room, that should be an equal footing conversation. I think the challenge in healthcare is very hierarchical, and for a good reason, like people could die if somebody who doesn't have experience makes a bad decision, and yet that makes it really hard for innovative solutions to thrive, so you have to bring in real people on the ground.
Yeah, excellent question for sure. I know when we were first starting Ecologicca, we essentially looked at what we called the 3 pillars of health. Environmental health, obviously, human health, obviously, but the last pillar was actually financial health. So when we were building out our technology, the biggest thing that we were considering was if this isn't affordable and doesn't actually deploy, then it's not helpful. So for us, we spent 2 years in research and development, making sure that the way that we were developing our products, our technology, all of those different things were as accessible as possible, because health shouldn't just be for people with money. And that was a big catalyst of why I actually started the business. Yes, I've had my personal health experiences, but I lived in India as a strategy consultant, and seeing the inequality and the fact that, you know, essentially people had like the right to healthy environments because of where they were born just did not sit with me. So it's baked into our pillars to ensure that we're creating a solution where all people can access it and it can be rapidly deployed anywhere, so that there are not these barriers, so that we can improve that equity.
It's a great question. Our founder, Daniel, he came from the original Obama campaign. He's a community organizer by his background. So we have this famous New York City community retrofit program that as a new hire they make you read about. And so much of the secret sauce was these community advisory boards that we created in low-income communities. And internally there's like a persona roster of folks you want on these kind of boards. It's teachers, it's church leaders, it's young people, it's some experts that are in real estate and energy. And the idea is, it's self-serving. We're a private company, so we get programs with cities now, with Ithaca, Denver, Atlanta, Chicago, and when we win a contract to be their low moderate income decarbonization partner, we often, if it's not in their RFP, show up to that response and say, you need a community advisory board in this RFP, or else it's not going to work, because these communities are used to shady salespeople promising them energy savings and then leading to predatory lending or other challenges. So coming at it from a grassroots perspective is the only way it's going to work.
Can I amend something here? Two things. One, as I said, the people with the calculators, it'd be like the people with AI. I was like dating myself. But seriously, I think we could all do better. And we're all saying like, yes, we bring people in. Some of my favorite programs have been the ones where the co-creation or participatory design happens in the community. It's coming from the community. So how do you equip communities with the same access to knowledge and funding that like you all have or I have? Or right, that's a bigger question. There's this assumption that like, well, we're the innovators and they're the beneficiaries, and the reality is like we have to break down that barrier. And I think of some of my favorite programs where you can force that. You can design a program and say like, you have to have a community board, or you have to have somebody who's benefiting economically, not just being a beneficiary. So if anyone's doing that, I'd love to talk to you.
Hi,
You guys talk about doing things quickly, right? When it comes to building scale, especially in smaller kind of markets like a Detroit or Indiana, what does that look like in terms of pathway, getting past the red tape and some of those things?
I think New York's actually slower than, like, I grew up in rural Wisconsin, where like you just throw something up, nobody's gonna pay attention to you. Yeah, I think, cutting through red tape, like HHS, Health and Human Services, had this like really great internal program called Hacking Red Tape. And so I think that's something that, do you guys have anything like that in the city?
I mean, there have been many iterations.
We've tried,
but yeah.
because it's hard.
Yeah,
Do you agree? It is harder
I
in New York.
agree, yeah. I would
Okay.
say it's harder here for.
I don't know, you might know.
Well, I mean, I worked for the city of Santa Monica in Southern California. It's 90,000 people, it's surrounded by LA, but it's its own city. And I was there 5 years, and by the time I was done, I was like, I'm done with the city. This is too much bureaucracy, too much crap. And I went to Google thinking it was this high-tech company, and it turns out it was like more bureaucratic than Santa Monica. And now I'm in a company where we're engaging with a lot of different cities. And so I would probably agree with Sarah. I think it's not one size fits all. Everyone needs to get better at this. But I think the way the Inflation Reduction Act funding is flowing down, and the urgency of which right now the White House is trying to deploy it in low-income communities, is hopefully going to lead to accelerated permitting and reduction of red tape. But I can't speak to seeing that in field yet.
I mean, the Economic Development Administration had a number of programs, like generational investments in local communities that they call distress. So not the New Yorks, not the San Franciscos. The Build Back Better Regional Challenge is a great one. So I think maybe the question, I don't want to put words in your mouth, but I'm wondering if it's less about speed and more about access. Like, how do we divert funding to the places that like get overlooked? It's easy for New York City to put together a winning proposal for something amazing. I mean, we still want that money, but like, how cool is it for like Milwaukee to get that money?
And just from a government funding perspective, there are agencies within the federal government that are focused on the rural aspect, and actually every agency at the federal government has a rural access sort of plan. And I'm not going to say that the government is fast. They are not fast. Nothing. I mean, we're doing this ARPA-H, Sprint for Women's Health, and they announced it in February. They're going to award the money by September. That's the fastest I've ever heard of anything happening at the government. And they've already missed their first deadline, right? So like, they were supposed to announce in May who won or who was invited to the in-person pitches. Not a peep, but they're gonna try. And so I think if you contact these folks and you talk to them and try to get the money flowing, that's one of the ways to do it.
And on another note, to kind of go back to what I had said previously about collaboration, one of the ways that we have gotten into essentially places where we had like no business being was by finding people that we could work with and complementing their strengths to solve a larger problem for their existing customers. So we can go to them and say, hey, you've got this customer. We know that they're going to be experiencing this problem. If they aren't yet, they will. And here are the reasons why. Partner with us on this. We know that you don't do this. We're not trying to cannibalize. Let's all work together here. And it helps you to like kind of get your hand held into rooms where you might not be able to get in yourself. And the other thing that we do is like, we talk to our customers a lot, like an annoying amount, and really drilling down into like the person that's having the biggest problem today. That's how you can get in a little bit quicker, because someone that's having an asthma attack needs a solution today. Someone that's like, I don't understand this problem at all. Love you, talk to you in 3 years, but like, you're not my person right now. So you obviously want to keep your doors open, but when you're talking about speed, it's like, how can I be super empathetic to the issue that is present today in order to allow myself to do data collection, partnerships, whatever is necessary to grow your business, so that when those other later stage adopters do come around, you're in a position where you can go into that room on your own.
Hi, My name is Ibukolu Adebayo. I'm founder CEO of GreenSoul. We're accelerating access to renewable energies in marginalized communities starting in Nigeria. My question is around, African interests, especially around all the things that we've discussed, government funding, financing, non-dilutive financing, and all. Do you guys have any insights on how to access, some of those resources that can support some of the work that we're doing in our communities in Africa?
I think USAID, sorry. They have a number of programs, lots of non-dilutive funding. There is like an international trade, it's called the Bureau, you might know better. I will find it for you and send you that link. I think in the pandemic we realized that global health, global climate is like local health and local climate. We don't, yes, there are oceans between us, but what happens in Nigeria affects New York and vice versa. So there are some federal agencies that are particularly interested. Do you know of any other, Joyce, that are, foundations as well, Gates, and those types of, the big ones for sure.
Mostly private foundations. USAID is the biggest funder for international, but HHS through CDC might also have some. It's a competitive landscape. There are like 3 or 4 major nonprofits that get almost all the money. So if you can partner with like Doctors Without Borders or a International Medical Corps, they can you can be their partner in Nigeria because they don't do anything they don't send their people everywhere. They don't have enough. So they're always looking for on-the-ground support.
Another tip might be to also look into whatever the innovation hubs are that are close to you, because those are active resources for startups and small companies. If they don't know, there might be a founder there that does. Like I heard a pitch in Vancouver a couple of weeks ago, and it was a company that was providing digitalized healthcare to underserviced communities in Kenya. And so, I didn't speak with this founder, but I did hear them. I heard what they were doing, and there were several other people in that room that knew them. So getting into those rooms that are like low barrier to entry, especially for startups, and then just talking to people. They can make connections for you to other people that are doing things that are similar, that might be complementary, or be able to provide you with like a low barrier to entry resource that like feels easy and tangible.
I think we have time for one more question, and then we're going to pivot to all of the panelists. Everyone comes up.
Yeah, can you hear me? It's on? Okay. Hi, thank you. This has been great. I was curious with the greenhouse gas reduction and your air conditioning, right? And that's a big push right now at the bipartisan inflation law and the Inflation Reduction Act, and we're seeing the needle moving forward on the invisible pollution from greenhouse gas by changing air conditioning. But when we talk about marginalized communities, talking about greenhouse gases is a little bit invisible, so to speak, whereas air quality is something that really impacts marginalized community. Are we missing an opportunity here as we're going in and putting in heat pumps and changing the fundamental infrastructure in the building and not getting after the air quality problem at the place that everybody has air quality, which is in their homes? And it seems like we're missing an opportunity because the policy was just really targeted towards bringing down greenhouse gases and not really addressing what we're seeing with ClimateTech, climate and health intersection, which is the air quality issue, which people actually do see and understand it's much more tangible. And I wonder if like a little bit of a policy tweak there could actually make a bigger impact that down the road 10 years from now. Obviously, we can't make policy changes, we can lobby for them, but what I'm suggesting is that we're missing by just a few $100s or $1,000 more as you're going into a building to redo the heat pump and the HVAC. If you put it in an air filter, it would save it. And coming out of COVID, everybody understands this concept and the importance of air quality. So I just look at this as a place where we can And I'm wondering what, BlocPower thinks about that, and Ecologica, what your thoughts are about this, and is there an opportunity there?
100%, absolutely. We've actually started to have some early conversations with heat pump companies, where part of the R&D that we're doing right now is for a product that can be retrofitted into a heat pump. So when they're existing or when they're being replaced or put in, it's easy, it's affordable, it's not a big deal, and it's a 2-in-1. And then we also get that data collection. I think that we kind of touched on this previously where, yes, people are very focused on climate right now, but even with regulations, like the health stuff is coming, so we have to be forward-looking, because then we're gonna just keep being reactive when it's like, okay, here's an opportunity where people are changing things anyways, let's be proactive and anticipate the issues in the future. So the answer in short is yes, from my perspective.
Oh, sure.
Well, yeah, I think one of the biggest levers, even when I was at Google doing this with super high, complex, expensive, high-profile buildings, and now BlocPower, we focus more on low-income multifamily. In both scenarios, to help get the project done, the best way to do it is time it when the existing infrastructure is going to fail. But these are 15, 20, sometimes longer year systems, so it's so important for us to hit that moment right. But I met Jenessa last night and learned about Ecologica, and my wheels are already turning to think. We meet buildings, so they'll hear about an incentive or BlocPower, and they'll say, hey, like, want to know about this heat pump thing, and we'll learn, well, they just installed their boiler a couple of years ago. And we even think maybe from an embodied carbon standpoint, we shouldn't pull that out. Let's stay in touch and get you prepared for when it does die, and use existing tools and resources in collaboration with companies like Ecologica to retrofit the existing system to address the air quality, and continue to hope, and it sounds like they're even working on this, influence the next generation of heat pumps to be dual functional, not just reduce the greenhouse gas emissions to be more efficient, but also contribute to the indoor air quality.
I'll also add that a lot of policy is written with latitude. So when we think about all of the infrastructure investments, like if you're going to replace pipes to eliminate lead or whatever it might be, or failing pipes, why not make them smart and have sensors for wastewater? If you're going to do X, Y, Z, there's really nothing that prevents you from doing it. I love the idea of like adding it to the policy. But before I worked in government, I did not realize like how this all comes to be. And when you get to know these people, many former administration folks from federal, state, local, they go to philanthropies after an administration and they bounce back and forth. And so pay attention to where philanthropies are, like the big ones, are pushing science and tech, as well as the administration, because those policies last for, you write something under one we won a contract under Obama that we just finished. So, you're really looking at it over the long term, and you have to read between the lines, and you need to find the philanthropy or the private sector entity that sees that opportunity, like you might as well do this at the same time as that.
Awesome. We'd love to invite Ben and Evan back up, and we're going to have a bit more of a conversation around like these intersections that we're having, just making sure we get all the perspectives back in. And I think maybe one of the questions to seed that discussion as you guys come back up is we'd love to hear, this is Tech Week, so we'd love to hear about, for example, different startups that you think should be founded, should be created. What have you seen, especially at this intersection? It's very new. There are companies on both sides. We haven't seen many, like we've seen Ecologica, a couple more, maybe myself, but there's not many companies being built in this space, and we'd love to hear perspectives on what do you guys think should be built. So inspire some of our builders in the room as well.
It's a great question. From a climate perspective, when I think about innovation, I think about battery storage. So battery storage, I think, is ripe for innovation. It's a hard problem to solve, but it's a super important problem to solve. And capturing that energy and being able to store it and deploy it at a future date, I think is essential. And obviously all things climate will sort of port over into all things health and city health. So that's where I think innovation needs to come?
I mean, that's an easy question for me because I'm like, I want people to partner with me. So, you know, we're in the air quality space, but there are so many other environmental contributors to health, you know, water, food, noise, all of those kinds of things are massive contributors. And even when you look at the Harvard School of Public Health, they outline 9 environmental contributors to like a healthy workplace. So our business covers 3 of these 9 components, but I'm like, hey, where are the other 6? Like, let's all get together and create a holistic circle. We can collaborate. Again, I love collaboration, so I'm like, you know, where are the water people at? Like, let's chat. Yeah, there's a lot of gaps at that intersection for sure.
Still thinking. I guess what I would like to see is I'd like to see local governments, like they are innovators too. I want like a reverse competition for like the first city to do something. Like the first city to like make sure that they have a threshold for clean air in schools. The first city to, you know, because we all know it's the right thing to do, and you know, I want to take like not quite the stick and the carrot, but I'll make like a carrot stick. And some billionaire is going to put up tons of money and maybe it's not, I mean, it's finite, but maybe everyone can win. Like, you do it great, here you go, congratulations, keep going. So that would require the innovators to be part of that, but I actually want to see the cities make that first move.
I love the idea of a heat pump that also cleans the air. I mean, I think that threads a needle that is really important, and it was heartbreaking actually through the pandemic to have this tension arise all of a sudden between the way we would retrofit our buildings to reduce energy use and the imperative of trying to increase air circulation. The other one that we haven't talked at all about, it's sometimes on my mind since I worked a lot on traffic safety and vehicular preventing traffic fatalities in the city of New York. Electric vehicles are very heavy and the batteries are very heavy, and so making sure that the next generation of vehicles that might be lower carbon doesn't inadvertently create a lot of new pedestrian safety or vehicle occupant safety challenges on the road, I think is a really interesting question that is right at that intersection of how can we be solving a climate problem and also being cognitive of another major health risk that comes with vehicles.
I mean, my answer probably is going to be kind of annoying because it's not very specific, but it's around this smart connectivity of devices and their interaction with the grid. And it was something we thought a ton about at Google. Everything we looked at from a real estate sustainability team was how do we apply technology, how do we use Google's technology to solve our own problems. But Google, and rightfully so, and any other building owner, is so concerned about cybersecurity. So the more points of failure you have in a building that are connected to some cloud that's ideally in this future state, this great solution to move energy around when it's needed and reduce the base load of these pieces of equipment when it's not needed. There's a ton of energy opportunity there. But yeah, I mean, this like cybersecurity challenge is really hard to overcome. And I don't even know, is it government, is it pilots, is it new technologies that help solve cybersecurity? But it's a weird intersection where you think, well, what's preventing this like we've said a bunch here, this technology exists. You could be connecting everything that's run on electricity in a building to each other, to the grid, but cybersecurity really holds a lot of it back.
I have a really unsexy idea, but it'd make a ton of money. So you talked about local law 97, but like local law 11 is like the bane of my existence. That's the, like all the buildings are in scaffolding. You have to like check your building every like 5 to 7 years, and you have to repoint it. There's a lot of aging buildings. It is extraordinarily expensive, increasingly due to insurance costs. I mean, it is not tenable anymore for like co-ops to be able to, and any really building to afford this. But you could use AI to, quickly detect where there are problems. Now, I'm going to take that example because I'm living through that right now for like the 3rd time. Local Law 97. Like, how could, I'm thinking of city vendors, make that process easy on the buildings, because New York City is very unique for our buildings. Who owns them, who lives in them, where they are, how different they are across architecture styles, material styles, and if somebody could develop a package to do both the the software and the hardware, because this is like, I sit on the board of a company called Context Air. It's called like AI for the blue collar worker. You need both. You need the AI to understand where the problem is, and then you need to have like a human who is going to be on that building. So if somebody wants to do that, I would love to see that, and I will be your pilot.
Yeah, sure. Just kind of riffing off this, I guess another call to action. I think wildfire smoke and the impact on human health is really important. I'm a primary care physician by training. As we think about the increase in wildfire and the impact on lung health, a lung health wearable device would be incredible. We see air pollution and smoking being the #1 cause of COPD, just chronic obstructive pulmonary disorder. It used to be smoking caused emphysema. I think we're gonna see now air pollution being the #1 cause of emphysema. So as you can imagine, ERs will be overrun with patients in wildfire zones. And as these wildfire zones keep increasing, this is gonna lead to incredible healthcare costs. Something like $20 billion of healthcare costs will go into just the risks of wildfire smoke on lung health. So another area for people here.
Should I yell?
Yeah, let's try that.
Okay. In buildings, you can usually see the building before you buy it, and you can like go through it, underwrite it, see where the leaks are, see where the cracks are in the floor plates. In healthcare, in this example, or once you get AI involved, then you're usually relying on like 5 to 10 census responses per year that like bid you into quartiles for your credit score, for your flood risk insurance, for your health insurance kind of benefits. So I'm curious what you think about the idea of like taking a page from the real estate handbook where you know the broker is incentivized to like jack up the sale price. And then you're just skeptical of whatever broker tells you for like your cost estimate. Like you'll look at their Excel sheet, you'll be like, here's the assessed land value, here's whatever, here's a comparable set. But in healthcare or these other areas, you're not as skeptical of insurance or in flood risk. That was my earlier question, like what is an act of God? So I'm curious whether we should take a page from the real estate playbook.
So I've actually been thinking about this directly. I'm making a company that's exactly thinking about that. So there's a huge problem in a few ways with trust networks with our doctors and communities, right? So I live on a floor where I'm one of 6 people who speaks English at home. Down the street, there are like 17 pharmacies, literally. I live in Queens, so this makes only sense in Queens. So there's like literally 7 pharmacies down the street. What's the difference between them? It's their cultural bent. Now, you could make some extrapolation. If you didn't live in New York, that would sound quite racist. But living in New York, knowing how many languages your neighbors speak, and the #1 place where you actually need to understand the person is the pharmacy, right? So we're thinking about like holistic care kind of, and linking people together based on their real life trust networks, right? Like I'd probably go to whatever this doctor is for whatever reason, there's a community behind it. So when we're thinking about that trust network, the second thing we're thinking about is like information, getting information out to people, right? So we have all these programs. No one in the world knows how to use any of these health programs, right? Joe Biden made whatever for, does anybody know how to access that? Do you know how it applies to you? Do you know when you look at a bill, like how to actually argue against your bill? Because yeah, we now have all these patient protections, but do you know which line item makes sense? So it wouldn't be nice to put your bill somewhere and say, oh, by the way, your bill looks wrong in this place. Did this really happen to you based on what you explained to me you went to the doctor for? Like, did you really get this test? Does it make sense? Does it cost this much? So we're actively thinking about that right now and thinking about how to use AI to get at those very simple, like how to alert people in a way that like your tax guy does, right? Your tax guy, you put in your taxes, you answer 6 questions and it says, you should be using these 3 deductions. No one ever does that for your medical bill. So like, yeah, people are thinking about that.
That's cool. When can I have it?
When you give me money.
You're good.
I'll just kind of following up on both of those points. I think from Ryan brought it up and Sara Holoubek.
Naomi.
Really thinking about different aspects of the healthcare infrastructure, whether it's pharmacies or hospitals. I think that's a sector here that's not, we don't have too well represented today. But from the perspective of like where people seek health and also this opportunity of health storytelling with climate, I was thinking of the example you gave, Joel, of your relatives who are asking about the health effects of gas stoves. I think weaving in health into all different aspects of climate, whether direct or from a storytelling perspective, to really motivate people and get people to care more from this personal perspective is powerful. So I was just curious to hear any thoughts on that topic of how to weave health storytelling into all of the climate programs.
Yeah, I mean, that's essentially what we do, and the big thing is making it personal, like you said. So we start with this high-level data collection, and we are very careful about the way that we do it in order to make sure that it is trusted. Because the first thing to do is overcome that barrier of trust. So once people feel like, okay, this is legit, I'm more interested, you've got a little bit of a foot in the door. And then it's applying it to them and making sure you're speaking that language, and then being sure that you're telling them the right things in the right way so that they can apply it to their lives. And again, for us, that all starts with this macro, high-level data collection from trusted sources that is indisputable, and then bringing it down to the personal level and then communicating on that on a level where it's not scary. We definitely, I really do not love like the fear tactics that people use, especially in this space, because the whole climate issue can feel so overwhelming. And I think that a lot of people will get to a point, or maybe already have, where they're like, I don't even want to think about it. Like I have a close friend that very much subscribes to the ignorance is bliss life. And that's the opposite of what I do. So ensuring that the way that we communicate is in a way that makes people feel empowered, and uses information that is trusted, I think is the first way to get more people on board.
I've really found that the air quality connection can be really powerful with people, and even the example about someone who doesn't really care that much about climate, you start talking about risks to your kids, it can really transform how they think about this stuff. The one example I give is we spent a lot of time thinking about the future of New York City school bus fleets and shifting towards electric school buses. There was a really influential set of studies, I think this was done a number of years ago now, where they had school children wear air quality monitors around their necks all day and sort of see where it would spike, and it was like getting on and off those diesel school buses, you sort of visibly see the spike of how bad the air quality is. I mean, you tell a room of parents that, they're like, sure, where can I sign up for electric school buses? You never need to say the word climate change, and they're totally ready to shift to a different rolling stock. And that's been very powerful. The stove is another great example, but that connection I found really powerful.
I think we talked about this yesterday in terms of education. So we were talking about women's health and how a lot of medical doctors are not educated on menopause. So when women come to them and they say, hey, I have these symptoms, everyone's symptoms are different and doctors aren't trained to see it. And it's the same thing with environmental impacts on health, right? The education needs to start at the doctors as well, so that they can start spotting, okay, we talked yesterday about if you live in Phoenix, you might need to have different types of drugs because you're in a high heat area. But unless you're educated as a doctor to know that, there's no way you'll be able to inform your patients of what the environmental impact is. And that then leads to the cycle of your patients understanding more and influencing the policymakers.
And the challenge with that is, medical school takes a very long time. Chethan, how long do you have to go to school for?
It's
so long.
It's a very long time.
So, if you were to start that type of training today, that person will be your doctor in 6 to 8 years. and the world will have changed. And so, but I think that's it. Like, you have to start training, but what do we do for, we have to prepare for the people of the future, but the people of today. And I don't have a good answer, but that would be a great company to start, and I'm sure somebody would invest in it.
Amazing group of people we gathered. We were really excited to put together this conversation. We made it super intersectional from all the perspectives: academic, regulatory, startups, funding, community, lawyers, and so the city. And so thank you. Thank you so much to Fenwick for hosting this. Thank you, Evan, for enabling my project. And so we have a few more minutes in this space, so you guys get to mingle with each other and the amazing panel. This was great. Thank you a ton to everybody who attended and stuck around. And enjoy the rest of your tech week.